Diabetes was one of several personal challenges Mary Tyler Moore dealt with during her lifetime, and in typical fashion, she used her experience with the disease to help others. Many of her fans are embracing that strength in the wake of her passing at age 80.
She was always such a great spokesperson for the juvenile diabetes research and just women's independence in general. So she was just a great role model.
So joining us now to talk about Moore's contributions is Dr. Howard Selinger with Quinnipiac University's School of Medicine. Welcome and thanks for joining us today. So how important is it for a high-profile person like Mary Tyler Moore to get out in front of a disease and advocate for awareness that way?
I think it's very important because it can provide funding for basic research that can help to work towards a cure for type 1 diabetes and make people much more aware of the much higher prevalence of type 2 diabetes.
And we'll talk about those in just a second, but first, she did have type 1.
She did.
How does that impact someone's life?
It's very much a problem. You have to be very vigorous and diligent about controlling your blood sugars multiple times a day. Many people have embedded insulin pumps, and it can damage the eyes, the kidneys, and the cardiovascular and cerebral circulation over time, no matter how hard you try to manage it well.
And as you just mentioned, type 2 affects far more people. What's the difference between type 1 and type 2?
Type 1 diabetes is a lack of insulin. So you have to replace it with insulin through pens and vials. Type 2 diabetes is due to obesity, inactivity, and the pressures on the diet in this country, and it's an inability to use properly the insulin that you already produce.
And that affects far more people, probably, I don't want to make guesses, but probably because of the obesity epidemic or the overweight epidemic that we're facing.
That's exactly right. The ratio is probably 10 to 1, type 2 to type 1. Same complications occur. And I tell a lot of my patients, if you lose the obesity, you will lose the diabetes.
Mary Tyler Moore was also an advocate for stem cell research. What is the link there?
The link in type 1 but not type 2 diabetes is if you can implant stem cells in the pancreas that can produce insulin, that's viewed as a potential cure for type 1 diabetes, but will not help type 2 unless you are both insulin insensitive and lack some degree of insulin.
Okay. All right. Dr. Howard Selinger, the Quinnipiac University School of Medicine, thank you for joining us today.
You're very welcome.
All right, Jen, back to you.